नमामि धन्वन्तरिम् आदिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारुग्भयमृत्युनाशं दातारमीशं विविधौषधीनां सहस्राक्षं गणाधीशं स्वगुरुं च सरस्वती जनकं जनयित्रीं च शास्त्रादौ प्रणमाम्यहम्. Quoting the very first verse or the shloka from the Sushrutha Samhita, I welcome everybody to the second session of the series, The Science of Surgery in Ayurveda and its Relevance in Current Times. So in the first session, we had seen the introduction to Ayurveda. We saw what are the basic principles of Ayurveda. We saw various misconceptions, or we answered various questions that come across in the mind of a layman about Ayurveda system. So in today's session, we will be looking at the overview of the Sushrutha Samhita, which is the Gita of surgery or the surgical principles. So when we say surgery, first thing we have to know about the concept of surgery in Ayurveda is what is this surgical science called as in Ayurveda. So in Ayurveda, the surgical science is called as Shalya Shastra, which comes under the Dhanvantari Sampradaya, which is majorly explained by Acharya Sushruta in his text Sushrutha Samhita. So among the Brihatrais, the Charaka Samhita, the Sushrutha Samhita and the Ashtanga Hridaya, we have the Sushrutha Samhita, which gives more emphasis on the surgical aspects of treating various disorders along with the conservative management or the clinical management using medicines of diseases too. So here when we say about Shalya Shastra, and we say that this Shastra mainly was given by Acharya Sushruta, who is still considered the father of surgery. We get to see in the Sushruta Samhita the very first Adhyaya of the Sutrasthana, wherein Acharya Sushruta himself quotes that Atha Khalu Bhagavantam Amaram Rushiganam Parivrittam Ashramastam Kashirajam Divodasam Dhanvantarim Aupadhenava Vaitarana Aurabhra Paushkalavata Karavirya Gopura Rakshita Sushruta Prabhrutaya Uchuhu. So when we come across this shloka, we get to see that it was not just Acharya Sushruta, but there were many contemporaries, or we can say as classmates of Acharya Sushruta, who learned this Shalya Shastra from Acharya Divodasa. This Kashiraja Divodasa Dhanvantari is also, according to some historians, believed to be the second Dhanvantari who learned this Shastra, Ayurveda Shastra, from Bhagavan Dhanvantari himself. So next, the knowledge of Shalya Shastra, it passed on from Divodasa Dhanvantari to Sushruta. So here again, in case of Acharya Sushruta, we have references of two names, that is the Vruddha Sushruta and the Sushruta. So when we get to listen to the names of both of these Vruddha Sushruta and Sushruta, people opine that it was Vruddha Sushruta who learned this knowledge from Divodasa Dhanvantari, who then wrote the Sushruta Tantra, wherein the Sushruta in later times he did the Pratisamskara of the Sushruta Tantra. So in such case, now we'll have to think about the time frame of both of these Sushruta. So it is said that this Vruddha Sushruta was somewhere around 1000 to 1500 BC, whereas the time frame of the Adhunika Sushruta was around 2 AD. And that Acharya Sushruta, he practiced and he also taught surgery on the banks of river Ganges. And he lived in the ancient city of Kashi in the northern part of India. This Sushrutha Samhita, written by Acharya Sushruta, it is in two parts, that is the Purva Tantra, which has 5 sections, and the Uttara Tantra. So mainly it is said that the Purva Tantra, which has the 5 sections of the Sutrasthana, the Nidanasthana, Sharirasthana, Chikitsasthana, Kalpasthana, was by Vruddha Sushruta, and later the Uttara Tantra, which consists of 66 chapters, was added by Acharya Nagarjuna in the later stages. So here when we look at the various subjects that is explained under each of these sthanas. So to briefly comment on the same. So Sutra Sthana, it consists of 46 chapters and it mainly deals with basic principles of medical sciences and pharmacology. In Nidana Sthana, it has 16 chapters. It deals with the pathological concepts of diseases. In Sharira Sthana, it has 10 chapters and it basically deals with human anatomy and the concepts of Atma, Indriya, etc. The Chikitsa Sthana has 40 chapters or 40 adhyaya, which stresses basically on the medical management and also the surgical management of diseases. The Kalpasthana has 8 chapters that dedicates itself to toxicology, and the Uttaratantra, the 66 chapters. The same which we can pick up a phrase from the Sushrutha Samhita is that Prag Abhihitam Savimsham Adhyayashatam Panchasu Sthaneshu Tatra Sutrasthanam Adhyayaha षट्चत्वारिंशत् षोडश निदानानि दश शारीराणि चत्वारिंशत् चिकित्सितानि अष्टौ कल्पाः तदुत्तरं षट् षष्टिः. So this is the brief explanation of the number of adhyayas and the number of sthanas in the Sushrutha Samhita. So with all of this, here we can get to know that Sushrutha Samhita is one of the oldest known text, and it describes everything in detail, starting from the examination, diagnosis, treatment, prognosis of ailments, operative procedures, plastic surgery, cosmetic surgery, etc. And it also contains the first known description of the basic surgical techniques. The extent of details described in the procedures are so startling, and it becomes so difficult for us to conclude that this was practiced in ancient India in the 1000 BC, making it very hard for most of us to realize that almost a millennium before the known famous surgeons like Hippocrates, etc., almost 2 millennia before many European stalwarts like Celsius, etc., or Galen ever appeared in the surgical field. So we had a man in our ancient India performing complex surgical procedures, including reconstruction of nose by cheek flap, earlobe repair, cleft palate repair, etc., and especially with instruments that was manufactured by himself. Thus, for this contribution, Acharya Sushruta has been aptly named as the father of surgery and also as the father of plastic surgery since time immemorial. Talking further about Shalya Shastra, then Acharya Sushruta defines Shalya as Manaha Sharira Badhakarani Shalyani. To crudely translate this verse, then it is um, nothing but a foreign body that is intruding through the equilibrium of the physical and the mental faculties. So one thing what Acharya Sushruta has stressed here is that a foreign body is not only up to the level of a physical entity, but also many uh, psychological phases like anger, jealousy, depression, grief, etc. All of these are also Shalya, that is foreign body, to the mental faculty or the mental integrity of the human body. If the history of this Shalya Shastra has to be traced back, then it can be traced back to an unmarked era of ancient time of the Rig Veda, wherein the practice of Shalya Shastra can be seen. So now we know what Shalya is, that is any foreign body including the physical or the mental faculty. And Shalya Shastra is that which helps us or gives us techniques on using various yantra and shastra, um, using which you can remove this foreign body out of the abode of this physical human body. The Rig Veda makes mention of the Ashwinikumaras, who are known as the Deva Vaidya, that is the doctor for the gods and goddesses. So they were the chief surgeons of the Vedic period who had performed very rare surgical operations. So without entering into complicated references of ancient texts, the later simpler version is provided by Ahuja and Mishra in 2014 edition in a brief overview mentioning the legendary surgeons and ancient Indian Ayurvedic surgical practices. So what the Rigveda actually says is that Ashwinikumaras performed the first plastic surgery to rejoin the head and trunk of Saint Chavana when Daksha cut his head. So the other classical works include an eye operation of Rijashwa, the implantation of teeth of Pushna in his toothless mouth, the transplant of head of a baby elephant on Ganesha whose head was cut by Lord Shiva in the rage of disobedience, rejoining the head of Lord Brahma and Saint Dadichi, severed by the demon Bhairava, and transplant of the head of a horse on the body of Dadyancha, preserved through Madhu Vidya, that is the honey method. So, in addition, they also transplanted an iron leg on Bispala, the wife of King Khela, who had lost her leg in a war. They also operated and repaired the excised head of Yagyana by Rudra. In other words, and on the face of it, the Ashwinikumaras were doing both homo and hetero transplantations at the very ancient time of Rigveda, that is 5000 years ago, according to modern historians. So, such miraculous magical surgical skills were seen in the Rigvedic time. Maybe the modern science could never believe such surgical skills existed. Nevertheless, this shows that to the true believers of the Vedas, this shows that it was the Rigveda that laid foundation to the surgical practice in the further period of Acharya Sushruta. This Sushrutha Samhita encompasses the knowledge of all the Ashtanga Ayurveda that we discussed in the last session, with special emphasis on the Shalya Shastra that is covered and explained throughout the text. So, in the entire text, if you have to see, approximately there are around 1120 medical conditions, including surgeries and illness relating to aging and mental illness. The compendium of Sushruta includes many chapters on the training and practice of surgeons. It also has 300 surgical procedures and classifies human surgery into 8 categories. Sushruta details 650 drugs of animal, plant, and mineral origin. It describes more than 300 kinds of operations that call for 42 different surgical processes and 120 different kind of instruments. So now when we look at Sushruta Samhita proper, an overview on its knowledge of the surgical science, then it has something incorporated right from the basic surgical uh, principles to the most complex surgical procedures like the operation for the cataract or the flap surgery, a part of the plastic surgery. So, moving on to the basic surgical principles that are told in Sushrutha Samhita. The first step for any surgeon, that is the surgical ethics. So, surgical ethics, even in modern field, is a vast subject that describes on how a surgeon should be, what are the duties, what are the rules and regulations he is bound to. So this surgical ethics has been explained throughout the adhyayas, not just as under a single adhyaya with the same heading, but we find information regarding the surgical ethics that has scattered through various lessons and chapters in the Sushrutha Samhita, amongst which the first one is the consent taking. So even if we have to touch the patient body, no, whether it is for surgery or for an examination, the doctor's duty is always to get a consent from the patient to um, seek permission for the examination of the patient. So this consent taking has been told in Sushrutha Samhita when he explains the surgery for urinary bladder stone. So at that point of time, the consent was taken from the Raja or the king of that particular place, explaining the terms and conditions and the complications that could be involved along with the surgery. So the next thing under the surgical ethics is how the physician or the surgeon should behave in times of emergency, as Atipatishu rogeshu na ichet vidimimam bhishak pradipta agaravachhigram tat kuryat pratikriyam, wherein the word atipatishu refers to ashukarishu. So in conditions where an immediate management is required or an emergency management is required, a surgeon should not stick himself to the exact protocol of management or treatment, but he should act in swiftness as though his own house is caught on fire. So such shlokas are found scattered and are found at many places in the complete Sushruta Samhita, especially in the Sutrasthana, emphasizing on the importance of surgical ethics. Further on, while describing the qualities of a surgeon, Acharya Sushruta says, Shauryam ashukriya shastam taikshnam asvedam avephatu asammohascha vaidyascha shastrakarmani shasyate, which means a person who possesses courage and presence of mind, a hand free from perspiration, tremorless grip of sharp and good instruments, and who carries his operation to the success and advantage of his patient, who has entrusted his life to the surgeon, and the surgeon should respect this absolute surrender and treat his patient as his own son. So, this is the extent of um, qualities of a surgeon that Acharya Sushruta describes or comments that none of the modern surgical text actually defines it as in the same way. Further on, before moving into the actual surgical practice over patients, Acharya Sushruta also stresses the importance of having a preclinical training on certain objects which are similar or which simulates the operative procedure over the patient's body. He stresses his students to gain expertise first on these models, and further on Acharya Sushruta says that the Shastra Karma has to be practiced on live patients. So this is nothing but the whole new subject of what is called as surgical simulation in modern surgery, wherein simulation is nothing but mimicking a scenario or mimicking an operative procedure, wherein the training surgeons they first learn the operative procedures over these models. So these models could be somewhere from a simple banana to a very high fidelity model, wherein that particular instrument will help you to simulate the entire surgical procedure, like for example an appendicectomy or a laparoscopic cholecystectomy, wherein the students will first practice over these models. They will gain all the skill, and they will also encounter the probable complications in the surgery, and only then will they be performing it on live patients. So this again is yet another very big surgical ethics of not conducting or not experimenting a surgical procedure over a live patient without having expertise on that field. So this entire concept of surgical simulation was first given by Acharya Sushruta, wherein he says adhigata sarva shastrartamapi shishyam yogyam karayet, wherein yogya refers to sadrusha karma abhyasa. So this sadrusha karma abhyasa is with respect to the ashtavida shastra karma, which are the 8 surgical techniques or methods of practice of surgery that Acharya Sushruta further explains, wherein students have to first um, get their sadrusha karma abhyasa on various other objects that look similar to that of the human body parts, and then only the Shishya must enter into the practice of surgery. So, during which Acharya Sushruta gives the technique of practice starting from pumpkin, watermelon, etc., to the technique of bandaging to be practiced over a toy, over a wooden toy, etc. So in entire adhyaya or a lesson has been or a chapter has been dedicated to this concept of surgical simulation. So next, moving on to the Ashtavida Shastra Karma. So Acharya Sushruta gives emphasis on Ashtavida Shastra Karma, wherein he says all the surgical procedures that are practiced is incorporated into these 8 varieties of surgical techniques. So whether no matter whichever is the operative procedure on whichever part of the body, any maneuver that is conducted as following various steps of the operation, all of these maneuver finally get subclassified under these 8 surgical techniques, which are called as Ashtavida Shastra Karma, that is Chedana, Lekhana, Vyadhana, Eshana, Aharana, Visravana, and Sivana. Wherein Chedana is excision technique, Lekhana is a method of scraping technique or scarification, we can call it as. Vyadhana, it is the puncturing technique. Eshana, wherein we explore or probe into the body cavity. Aharana, the method of extraction. Visravana, wherein we let out the body fluid or it is drainage. And Sivana, that is the suturing technique. So, Chedana, Lekhana, Vedana, Eshana, Aharana, Visravana, Sivana, and Bhedana, wherein Bhedana incorporates the process of putting an incision. So, the shloka reads as so, Tatra शस्त्रकर्मम् अष्टविधं तद्यथा चेद्यं भेद्यं लेख्यं Vedyam, Ashyam, Aharyam, Visravyam, Sevyam iti. So if we see this, so this eight surgical procedures will incorporate all kinds of surgical techniques that are followed even today. So the next thing, based on the principles of surgery, is the use of surgical instruments, wherein Acharya classifies it as yantra and shastra, wherein he classifies or explains 120 varieties of yantra and 20 varieties of shastra, the basic difference being the blunt instrument and the sharp instrument respectively. So he defines yantra as Manasharira Bhadakarani Shalyani Tesham Aharana Upayo Yantrani. So those equipments which help us to remove the foreign body out of the physical abode is nothing but the yantra, and shastras are those which incorporate sharp cutting edges in its surfaces, which helps us to perform these ashtavida shastra karma. So out of the 120 yantras, Acharya considers Hasta, that is the hand, to be the Pradhana Yantra, because it is using the hand that we hold the other instruments to perform any surgical procedures. So among these 120 instruments, it incorporates all varieties of surgical instruments that we encounter even in the current surgical practice, like the forceps, needles, dilators, speculums, lancets, etc. So almost all of them are described under the heading of yantras and shastras, and it is said that it is made out of either gold, silver, or tamra, or the iron, that is the loha, etc., and it resembles the faces of animals or birds, wherein Simhamukha, Kankamukha, Shararimuka, etc. So, based on the resemblance of beak or appearance of faces of various birds and animals, the operative end of the surgical instruments, or that is the yantra or the shastras, were defined and described. Out of this, if we have to see, Acharya Sushruta's description of Sandamsha Yantra are almost the first forms of the modern surgeons, what is called as the spring forceps and dissection and dressing forceps. So, in fact, his system of naming surgical tools, as we already saw, it resembled the appearance of animals and birds. For example, even in modern surgical instruments, we have something called as the crocodile forceps, hawkbill forceps, etc. So this concept is even adapted even today. So, and also that he was the first person to introduce diagnostic instruments and their principles, which were modified later with the introduction of the optical system. So, in what we called as the Nadi Yantra, all of these gets incorporated. So out of the same classification, do we also find the present day endoscopes too, which are used for diagnostic purposes. Apart from this, his basic surgical principles also gives information about 14 types of bandaging techniques that are capable of covering almost all regions of the body, and he also said that even this bandaging technique must be first practiced pre-clinically on dummies, and only then the student must incorporate himself to the actual practice of bandaging. Moving on further about the stress of anatomy that Acharya Sushruta laid importance on. So it was Acharya's belief that he always considered that to be a skillful and a confident surgeon, he must have the perfect knowledge of anatomy, or he must be an anatomist first before he becomes a surgeon. That is, tasmat nisamshayam gnanam hartra shalyasya vanchata shodhayitva mritam samyak drashtavya anga vinishchaya. So many people think that anatomy has never been given importance in the subjects of Ayurveda or in the Sushrutha Samhita, wherein that misconception is totally wrong, wherein 10 chapters of Sharirasthana has been completely dedicated to the study of anatomy and the description of anatomical parts, wherein Acharya describes everything from the macro to the micro level. He also gives explanations about the microvasculature in Sharirasthana up to the chromosomal level in Sharirasthana. He describes the 7 layers of skin that are very subtle to be visible through the naked eye, and he gives explanation of various membranes, fascias, ligaments, joints, bones, um, various coverings of the body. All of these have been dealt in the 10 chapters of Sharirasthana. In the same, wherein Acharya also says that to gain the knowledge of anatomy, it is important for a medical student to have the exposure to the process of cadaveric dissection. So there is also a method that has been told of how to preserve the dead body and how the cadaveric dissection has to be followed out. So this particular process of cadaveric dissection was first told by Acharya Sushruta and not any other modern surgical authors. So here he says, for dissection purposes, the cadaver should be selected with which has all the parts of the body that is present, wherein that person or the body uh, is not died due to poisoning, and also the same person should not have had suffered from any chronic disease before death, the body which is not more than 100 years of age, and from which the fecal contents from the intestine have been removed. So such a cadaver must be covered with kusha or the bark of various trees, and this has to be kept inside a cage. This cage to be put inside the flowing water, that is the flowing river, and allowed to decompose in a unlighted area. So after proper decomposition for 7 nights, the cadaver then be removed from the cage, and then the body is dissected slowly by rubbing it with brushes that is made out of ushira. Ushira, that is it is one of the fragrant roots of a plant, or hair, or bamboo, or balvaja. So that is one kind of coarse grass. So using this, the skin was very delicately scraped, studied, and this was how all the anatomy of the human body was described and documented by Acharya Sushruta. So this is how Acharya Sushruta laid importance on, right, starting from the cadaveric dissection to the knowledge of anatomy, and then to the preclinical training, and then the surgical practice of the on the actual patient. So he not just gave principles of surgery, and he not just gave to the world the design of various instruments, surgical instruments, but he also laid emphasis on the concept of sterilization, not just of the instruments. He also has given information on how to sterilize the surgical instrument, how to sterilize the operative room, how to sterilize the bed on which the patient lies, how to sterilize even the clothing of the patient, how to sterilize a wound. All of this are told in the Sutrasthana of the Sushrutha Samhita, wherein not just that, with any surgical procedure, Acharya Sushruta also says that every procedure is divided into 3 phases, that is the Purva Karma, Pradhana Karma, and the Paschat Karma. That is nothing but the pre-operative, operative, and post-operative procedure that we see in modern surgical practice even today too. So wherein he says in the Purva Karma what are those things or the prerequisites that has to be kept ready for the surgery with respect to the patient, with respect to the procedure, with respect to the materials that is required, etc. In the Pradhana Karma, he says how actually the surgical procedure has to be conducted, wherein he also says that before conducting the surgical procedure, it is important for the surgeon to make his patient comfortable and to gain the confidence of the patient for the success in his procedure. In the Paschat Karma, he says how the patient has to be taken care of, how sterilization of his bed and other things has to be done, what are the food and what are the qualities of food that must be kept in mind, what the bandaging technique should be, and on which day the bandage should be removed based on the season, based on the dosha. All of this have been told in the Sutrasthana of the Sushrutha Samhita. Not just that, Acharya Sushruta also has given information on the methods of arresting hemorrhage that could happen accidentally during an operative procedure. So during which he gives 4 kinds of methods of hemostasis, and this shows that Acharya Sushruta was a very efficient surgeon who knew the importance of blood loss during surgery and also knew the importance of arrest of hemorrhage during the surgery to avoid complications. So this is labeled, or this is given as a term under Chaturvida Rakta Stambhana Upaya, wherein Rakta is the Rakta Dhatu, that is the blood. Stambhana is the methods of arresting it. So Chaturvida Stambhana Upaya has been told, wherein it is Sandhana, Skandana, Pachana and Dahana. So it is nothing but wherein the blood flow could be arrested by apposition of the cut edges using stitches, or by application of styptic decoctions, or by cauterization with chemicals or heat. All of this have been various methods based on the extent of hemorrhage, whether it is low or whether it is high. Based on that particular sandhana upaya has to be undertaken to arrest the loss of blood immediately, is what Acharya Sushruta has emphasized on. Sushruta, in his explanations, has also covered the treatment for accidental burns, and he also has classified it burns into 4 degrees, and also the effect of heat stroke, sunstroke, and frostbite due to excessive cold, and also the effect of lightning over the human body, which was maybe common in those days. So, with this, we can imagine the extent of emergency management up to management of a person hit by lightning. So, during which Acharya says that he considers that all thermogenic trauma, whether it is due to extreme cold or heat, whether it is wet or dry, chemical or inert fluid, it produces almost similar damage to the human body, and hence it has to be managed as one entity. So this great value of Sushruta's classification could be realized from the fact that this concept gained validity in modern surgery only recently after 1950, but is now uniformly accepted in the classification and management of these injuries. Further, moving on to his contribution to the field of orthopedics. So, Acharya has given classification of various kinds of bones, and also the reaction of them to injuries. So, varieties of dislocation of joints, he named it as Sandhi Mukta, and fractures of the shaft of bones, which he named it as Kanda Bhagna, and these were described very systematically in the Sushrutha Samhita. So, he has classified and given details of all of these types of 6 types of dislocation, that is the Sandhi Mukta, and the 12 varieties of Kanda Bhagna Lakshanas. Along with that, he also has given the principles of how the fracture management has to happen, like, for example, traction, manipulation, stabilization, etc. How an orthopedic trauma could make damage to other parts of the body, wherein he also gives explanations about the compound fractures. He also gives explanation of when the fracture end has been completely severed out from the rest of the body. He also explains external fixation maneuvers, wherein he calls it as kapata shaina, which is the instrument or the technique used to fix a compound fracture. So all of these has been explained in the under the context of orthopedic surgery, and he also doesn't fail to mention about the importance of rehabilitation post orthopedic surgery, or which is very very important in cases of musculoskeletal injury. So Acharya Sushruta also stresses upon the rehabilitation procedure and the time frame and the importance of the same to regain the functionality or the ability of functions of that particular injured body part. Talking further about Acharya Sushruta's contribution to wound management, so Acharya dedicates almost very many chapters of his Samhita in the Sutrasthana and in the Chikitsa Sthana, explaining of how to understand a wound. Basically, he gives explanations about the stages of wound, and what kind of treatment must be incorporated at that particular stage of the wound. He, in the Chikitsa Sthana, he gives explanation about 60 types of wound management, wherein he calls it as Shashti Upakrama, wherein a surgeon, by knowing the knowledge of all of these Shashti Upakramas or the 60 techniques, and also with the knowledge of which technique to be applied at which stage of the wound management, can be successful in treating any kinds of wound or ulcers. So after the explanation of various types of vrana and its stages, Acharya also stresses upon Vranita Upasana, wherein this Vranita Upasana can also be defined as the management of traumatic patients for early wound healing without complication post-operatively. So that can also be considered as Vranita Upasana. So here in this case, Acharya stresses about rehabilitation, and he also says that this rehabilitation provides post-operative care to the wounded patients. So this particular chapter, it contains all the aspects of wound care, allocation of room to the wounded, situation and quality of bed, availability of air and sun rays in the room where the patient sleeps, the patient's dietary plan, his physical activity, etc., and all of those entities that could create a complication in the operative wound of the patient, and if so, how the complication has to be handled. All of this have been mentioned in the Vranita Upasana Adhyaya. Further, looking upon his contribution to the field of ENT and ophthalmology, so we can see that Acharya Sushrutha was well versed in handling surgical techniques of not just of surgical conditions but also of that of ophthalmology, that is surgeries related to the eye and its components, and also of the ear, nose and throat. So during which we can see that Acharya Sushrutha was the first person to operate on the cataract eye. And one thing what we have to note, that the structure of the eye or the components of the eye, wherein the cataract surgery mainly involves the replacement of the lens of the eye. So all of these, it incorporates very fine anatomical knowledge, very fine surgical skill, and also it we have to remember that it incorporates a variety of micro cellular structures and microvasculatures. But it is also astonishing that Acharya Sushruta had successfully performed various cataract surgeries in those days where no sophisticated instruments or microscopic technology were incorporated as the part of surgery. Also, that the same procedure of the cataract operation is also being followed even in the current era. Not just about the operation on the cataract, he also has given various operative techniques on other disorders afflicting the eye like pterygium, etc. He also gives various operative techniques of the diseases inflicting the nose, ear, and the throat, that is involving the oral cavity and the throat, which involves surgical intervention, like for example nasal polyps, tonsillectomy, okay, removal of ear wax, etc., removal of foreign body from the ear, many of which are usually practiced under the surgical wing for the ENT and the ophthalmology, most of which the procedures have been dealt and it was successfully practiced by Acharya Sushrutha. All of its description also are available in the Sushrutha Samhita, that is in the Uttara Tantra. The highest contribution of Acharya Sushruta in the field of surgery was in the field of plastic surgery, wherein Acharya Sushruta is also named as the father of plastic surgery because he was the first person to successfully practice both the graft and the flap technique that incorporates under the reconstructing surgery. So the highlight of Sushruta's surgical magnificence was the surgery of the nasal reconstruction, or it is also called as the rhinoplasty, wherein it is nothing but repairing the disfigured nose with the flap of the skin that is removed from the forehead. So Acharya used to reconstruct noses that were amputated as a punishment for the crime back in olden days. So this technique is practiced almost unchanged even to this day, and the pedicle forehead flap is being renamed as the Indian flap technique. So this knowledge of plastic surgery, it existed in India way beyond since Sushruta Acharya's times, whereas the first successful plastic surgery in the Western world was being practiced or was performed only in the 18th century, that too after a rigorous training of 20 years in India under the Indian surgeons, that is the disciples of Acharya Sushruta. Under the same context of plastic surgery, Acharya Sushruta also gives a very complicated procedures of something called as eye-lined flaps, and which is one of the techniques under flap surgery. In case of Karna Sandhana Vidhi, wherein he uses a piece of a small piece of flesh from the cheek area along with the blood vessel incorporated to be moved up to the level of the ear to perform a reconstruction of the ear lobule there. So this method of island flapping, which involves microvasculature technique and the vascular surgery too, lets us understand the depth of knowledge of anatomy, the depth of expertise of surgical skills, and the depth of precision and skillfulness that Acharya Sushruta had in those times, again without any sophisticated instruments that are used in current times to perform the same surgeries. Moving on with respect to the concept of Anushastras, wherein he gives explanation of Agni Karma, Jalauka and Kshara Karma, wherein Agni Karma with heat cautery, wherein Kshara Karma by chemical cauterization, and Jalauka wherein leech therapy, which in modern days it is called as biotherapy. He gives explanation of all of these very much in detail. Separate chapters have been dedicated for the explanation of these, their indications in different kinds of diseases, and the therapeutic value of the same, and how these are to be incorporated in places where a surgical management cannot be performed. Not just that, Acharya also gives a full-fledged explanation of the Kshara Sutra therapy and the detailed explanation of all the anorectal surgeries. He gives explanation of various surgical techniques, starting from the injury to the abdomen and the abdominal viscera, orthopedic surgery. The Sushrutha Samhita incorporates a much detail about various other surgical procedures too, which we will be discussing in the further sessions as we progress. Not just this, Sushrutha Samhita also gives emphasis on methods to deal with food poisoning, methods to deal with insect bites, snake bites, scorpion bites, etc., wherein he describes many procedures under toxicology, how to manage emergency cases in such instances. He also gives explanation on Arishta Lakshanas, that is, those symptoms that we see in cases of emergency or in cases of complications, like for example the symptoms incorporating like that of myocardial infarction or hypoxia or acidosis, etc. So all of these are described under the heading of Arishta Lakshana. He also gives good explanation of conservative management of non-surgical diseases too, starting from Jwara to Atisara, Chardi, etc. And he also stresses upon certain symptoms or diseases that could appear as complication post-operatively or as complication post to the ill management of other disorders. Not just that, Acharya Sushruta also has given explanation about the concepts of ulcerative colitis, Crohn's disease, IBS, pot spine, Hirschsprung's disease, etc., foreign body diagnosis, foreign body removal, gangrene and its management, how to manage an acute abdomen, and all of this. So Sushrutha Samhita, it incorporates all surgical principles, techniques, not just surgical, it also incorporates all kinds of medical management that is needed in the practice of medical science. Acharya Sushruta took surgery in medieval India to admirable heights, and that era was later regarded in ancient India as the golden age of surgery. Frank McDowell has very aptly described Acharya Sushruta in his book, that is, The Source Book of Plastic Surgery, as follows. Through all of Sushruta's flowery language, incantations, and irrelevancies, there shines the unmistakable picture of a great surgeon. Undaunted by his failures, unimpressed by his successes, he sought the truth unceasingly and passed it on to those who followed. He attacked disease and deformity definitively with reasoned and logical methods. When the path did not exist, he made one. Not just that, the Association of Plastic Surgeons of India celebrates his life and time by giving him a proud position in the association's emblem. Having said so, I would like to conclude this session on the overview of Sushrutha Samhita with special reference to the surgical concepts in it. Thank you.